Hello, I'm Dr. Daniel Gruber from the Department of Female Pelvic Medicine and Reconstructive Surgery at Walter Reed National Military Medical Center. Vaginal prolapse is a condition where the walls of the vagina fall down and sometimes out of the vaginal opening. Prolapse can also occur when the uterus falls into the vagina. This is a very common condition that affects millions of women.
There are several places in the vagina that can be affected by prolapse. This is an image of the normal pelvic anatomy, with the front of the body here, the bladder here, the uterus, the vagina, the rectum, and the sacrum, which is the lowest part of the spine. If a previous hysterectomy has been performed, then the top of the vagina would look like this. In some cases, the cervix is removed, and sometimes the cervix remains. The decision to remove the cervix is usually based upon certain medical factors and patient preferences. This decision is individualized for each patient. We divide the vagina into 3 sections: the front wall, the back wall, and the top of the vagina where the cervix is. Any and all of these areas can prolapse. Sometimes the prolapse is mild, such as this image, where the top of the vagina falls down. This is known as apical prolapse. Sometimes the prolapse is more severe, where the uterus completely protrudes outside of the vagina. If the uterus is absent and a patient has mild prolapse, the top of the vagina, called the vaginal cuff, prolapses. If the uterus is absent and a patient has severe prolapse, the vaginal cuff may protrude outside of the vagina and have this appearance. When the front wall prolapses, this is called a cystocele, and since the bladder is adjacent to this area, the bladder also falls down. This is often associated with urinary incontinence and can sometimes cause difficulty with bladder emptying. In fact, some women have to place their fingers in the vagina to reduce the bulge in order to urinate. When the back wall prolapses, this is called a rectocele, and since the rectum is adjacent to this area, it causes the rectum to bulge into the vagina. This can sometimes cause problems with bowel movements. Some women have to place their fingers in or near the vagina during bowel movements in order to reduce the bulge to adequately empty. The treatment options for vaginal prolapse include doing nothing, pelvic floor exercises, using a vaginal pessary, or surgery. Doing nothing is a viable option in patients who are able to empty their bladder well or who are not bothered by the prolapse.